Welcome, everyone. I guess I'll go and get started. I hope everyone's had a very good day. I see quite a number of people have joined. It's wonderful to see you all. I might have met a few of you before at previous GANSID events and virtual meetings, but it's a pleasure to see you all again for this lecture series. Yes, so very excited to be here with you all today. The goal today is definitely to be interactive and to be part of the conversation. And just at any point, feel free to ask questions or feel free to use the chat feature. There's two options you have. You have the Q&A or the chat feature as well to ask any questions or share any feedback as well. Because definitely, as always, the topics we're talking about today, it's both a science and an art. And there's many different ways of going about handling and managing work plans. So with that, I'm going to go ahead and share my screen and start the presentation. So again, today's focus of this GANSID meeting is on developing impactful strategic work plans, really focusing on how some of the tools that I like to use and some of the resources available to really help you think strategically, to help you think effectively, and to prioritize what you can accomplish in inherited blood disorders, particularly with the capacity of the organization that you have. So again, my name is Andrew Zapfel. I work for the American Society of Hematology as the Deputy Director for Global Sickle Cell Disease Initiatives and Alliances. And I'll share a bit more about my background over the next few slides. So our agenda today, again, we'll start with some introductions about myself and the course. Again, an overview of some of the key principles that we want to make sure we are reinforcing of foundations in strategic planning, some basics, building blocks of an impactful plan, resource mapping and partnerships, and strategic planning and action, followed by some wrap up and take home tools. The goal is that I'll probably speak for the next 50 or so minutes and then plenty of time for questions and discussion afterwards. And I do believe these slides will be made available to everyone after the webinar. So again, a bit about me, I guess I mentioned, I'm the Deputy Director for Global Initiatives and Alliances at the American Society of Hematology, particularly working in our sickle cell disease efforts. That means I oversee our work in the Consortium on Newborn Screening in Africa, as well as the World Coalition on Sickle Cell Disease. And I'll speak more about those two projects to share more about my background and experiences in inherited blood disorders. I'm also an adjunct professor at George Washington University. I have my project management professional certification, or a PMP, and I definitely suggest that as a great tool or resource for anyone working in project management. My background has been in HIV, maternal health, and human rights programming globally. Speaking a little bit about our work here. Yes, thank you, Mr. Obi. Feel free to everyone, if you'd like to, in the webinar, introduce yourself as well and share kind of your organization and where you're from. That'd be wonderful. We'd love to see who's joining us today. So part of my work is the Consortium on Newborn Screening in Africa, or CONSA as we call it, which is their goal is to demonstrate the effectiveness of laboratory-based newborn screening and early intervention services in 7 African countries. This project was initiated in 2020, and our goal is to work with clinical sites to screen and link children to care. So we're making sure to collect a dry blood spot, and those who do test positive for sickle cell disease enter into clinical care. We're capturing that data into a clinical registry and working with national and international partners, sustainability of these programs. We have 7 countries involved in the consortium. In West Africa, we have sites in Liberia, Ghana, and Nigeria. In Nigeria, we have sites in Abuja and Kaduna. And in East Africa, we have sites in Kenya, Uganda, Tanzania, and Zambia as well. So that's kind of my major job and major focus. But we also have the World Coalition on Sickle Cell Disease, which is also one of my major activities. The coalition is a public-private partnership of pharmaceutical companies, nonprofits, and civil society organizations dedicated to strengthening the sickle cell response, particularly in low-resource settings. This includes working with country stakeholders to develop national plans, as well as work with the United Nations and other global partners to mobilize technical and financial resources. So it's a bit about my background. I thank you all so much for sharing in the chat where everyone's from. I see a lot from Nigeria, India. I know it's very late in the day. Thank you for joining. Tanzania. It's really wonderful to see so many different organizations and participants. And again, as always, a little housekeeping before we start. Again, as I mentioned, feel free to use the chat feature or the Q&A feature to ask any questions. If I'm talking too fast or too slow, just let me know. But again, hoping to get through a lot of different information I think could be really helpful for organizations as they develop their strategic work plans. And then we'll kind of go from there. So I always like this because, as I mentioned earlier, strategic planning, strategic work plans, it's both a science and an art. There's a lot of technicalities that go into it, a lot of processes, tools, resources, research that has been done on how to effectively develop strategic plans. And there's a lot that goes into it. All these words here are key features. And when you're thinking about developing any sort of work plan to strengthen a response in your community, to increase awareness, to increase testing, and so forth, you really have to think about a lot of things. But it's also an art as well because there's a lot of relationship building that goes into this. There's a lot of understanding what the needs and desires are of very diverse individuals and so forth. So we're going to try to break this down a lot over the next hour and really work together to see ways we can use tools to take this kind of large, jumbled, huge piece of information and turn it into something that donors, foundations, or just generally people would like to take part of in your work plan. All right, so why strategic work plans? Strategic work plans provide a roadmap for reaching long-term goals, position resources and efforts, and help navigate and prepare for potential challenges. And I highlighted the key words here that I think we're going to talk a lot about. Again, it's a roadmap. And as we know, roads sometimes have bumps. They have stops, they have delays, and so forth. And those are things that we can't usually control for because, again, we've charted the map, but we can't see into the future. So the strategic work plans are meant to guide us in the direction we want to go. We aren't going to stick to them because sometimes we have to divert, sometimes we have to take detours. But generally, strategic work plans are meant to just guide us in the right direction to reach our long-term goals. And again, long-term goals, again, being those that are feasible, that we've worked with other partners on to see what's possible. They position resources and efforts, again, making sure that anything we want to achieve, we know what's going to take to get there, whether it be our volunteers, our staff, costing of money, individuals, engage the community, and so forth, and help navigate and prepare for potential challenges. Again, we cannot see into the future. We don't know what the future holds for any of us. We don't know what tomorrow will bring. But the idea is that as we're planning these things, we're trying to see, okay, what are some challenges that we could see happening, and how do we try to prevent those from happening in the first place? Yeah, and so then my also thing I always want to start with as our background is why do strategic work plans usually fail? They usually fail, and what do you mean by that is that you might develop a great plan, you print it out onto a document, and then it sits on a shelf somewhere, or it's saved in as a file in your computer and never seen. Or stakeholders or donors go, no, unfortunately, we cannot fund this or we can't support this. Well, many of the reasons why include ineffective resource allocation. So again, really not appreciating what the actual costs are associated with going into a project of that size or nature. And again, usually that's a quick red flag or a quick issue many donors will see is that, no, the goals you have here don't match with what you're asking for. Ineffective risk management, again, not really seeing the challenges that might come into trying to develop this. I recently come to this a new community space that's been opened up in our area and not fully appreciating all the hurdles and challenges that can come into trying to actually build a physical space. It's not my area of expertise. I'm not an engineer. I'm not an architect. But I've learned so much about just the realities that these things take time and experts that, you need to call on to effectively reduce any risks associated with it. Vague strategic goals, again, not donors or partners not really understanding your vision or seeing how as your organization can get there. Lack of organizational support. This comes up a lot sometimes with very strong boards where we might have board members of organizations who have very big ideas and want the organization to do a lot of different things. But the reality is then your workers or those who are tasked with overseeing your finances or your money will easily go, no, we can't achieve that, or we don't have the capacity for that, or that's way outside of our scope of our mission. And so there definitely always has to be a lot of great communication happening between stakeholders to make sure that everyone's on the same page, if you will. And then an imbalance of innovation and control. Again, We're not saying that we want to stifle your great ideas. You know, you have great ideas for a reason, and they should be implemented. But the question is always how to balance what your long-term vision, amazing goals could be in 10, 15 years, and what could be done in increments of 1 year or 2 years or so forth. So always recognizing there has to be a balance there between your long-term goal and what can be done over the next year or two. And the idea is to snowball it, that you start off maybe smaller, and each year as you prove successful and you show you can achieve things, your projects get bigger and bigger and bigger, which is always we'd like to see. So those are some basic strategic planning. So let's get into now, sorry, so that's the kind of the foundation, if you will, of strategic planning. So now we're going to talk a bit more about the basics, if you will, really looking to see how we can, look at some of the tools and resources available to get you started on the right plan to developing innovative and effective work plans. So as always, the first thing we need to think about, and again, thank you all so much. I love seeing all the different organizations and people from around the world on this call, is anytime you want to develop a work plan, you want to make sure you're setting the goals of that work plan and really thinking about what it is you actually want to achieve. And when you're doing that, you want to make sure you're doing these kind of 5 key steps here. First and foremost is analysis. You want to actually know what is the problem. What are the challenges facing? What does the data say? What does the community say? And how can I make sure that all of that is taken up so that when I'm writing the work plan, I have the base here. That anyone reading this work plan would say, well, how do they get to this solution? How do they get to this ability to change this? Oh, they looked at the data, they looked at demographics, they looked at what national strategies say and so forth. And then from there, obviously you want your community engagement. And of course, community doesn't just mean, one group of people, it means everybody. We'll talk a lot more about engaging people in a little bit, but it involves people living with the disease, it involves caregivers, healthcare professionals, government officials, key opinion leaders, religious leaders, you name it. For those who want you involved in the project, you should ask them first, is this possible? And would this be a benefit to them? And get their buy-in, because any work plan that doesn't have buy-in from stakeholders is going to easily be seen by global funders, global partners, and so forth as not possible. And that's the last thing you want to do, is have someone say, well, we never were told about this. Not good. So again, analysis, you're doing your own research to see what the problems are. You talk to people about it. And again, you're defining the problem. This usually in other courses, when we're doing more like strategic plans and bigger documents, you would do the fish model, where it's basically you define a problem, or it's also a tree and roots problem, basically. Sure, there's this issue here. Say, not enough babies are being screened for a disease. Okay, well, that's a problem. But then what are some of the root causes of that problem? Some of the root causes are the healthcare system doesn't have the testing and tools available to do this diagnosis. Okay, that's one. Another is the community is not aware of how to do testing or why the importance of it. That's two. Three might be there's stigma or discrimination or lack of awareness too that needs to be raised on it. And again, those are all different problems, all trying to get to that bigger issue of why children are not being tested. And your organization's task to say, what's our role in this? Your organization might not be a hospital. If it's not a hospital, it shouldn't be doing clinical testing. What it could be doing is raising awareness. And then from there, you say, here's what we're going to do to address this problem. That comes from the identifying achievable solutions. Many people will jump to, okay, we're not testing babies. All right, we're going to create a clinic that's going to focus on this. Yes, that could solve the problem. But is that achievable, really, based on the capacity you have, the networks you have, and so forth? Maybe it makes more sense to partner with the local hospital and say, okay, we're going to raise awareness on this disease. Can you bring nurses and community health workers to talk more about it and say how ways we can find testing to happen? Things like that could be done. And of course, then develop a plan, which we'll talk more about that. So defining the scope and time, again, many people have seen these before, but they're always worth reiterating. I live and breathe by SMART objectives. And I think oftentimes what I see people see happen is that people skip this step, and then they immediately start trying to implement or develop activities. And if they've taken the second to go through a SMART review, They would have seen the errors of their ways or just really made sure their eventual work plans are much stronger. So again, when you're developing a work plan, you've done the analysis, defined the problem, you're ready to come with solutions. Those solutions should be smart. They should be specific. Again, that someone could really tell, okay, this is exactly what you're trying to do. They should be measurable. I know when you'll be successful in doing so because you can tell me you did X, Y, Z happened. They should be attainable, again, based on your capacity of your organization, relevant, again, that they can be done successfully and that they're going to really make an impact on the people most in need. And then time-based as well, because we all know projects and work plans, they have to have an end date. Work plans can't go on forever because it's not a work plan anymore. That's an organization, that's a program, that's something like that. Work plans are meant to be specifically time-bound activities that can be accomplished. And then once they're done, you see what worked, what didn't, and then develop a new work plan for the next set of activities. After you develop these smart objectives, then you really understand the scope of your project. And a scope is specifically what you're setting out to achieve. And what can happen so many times in work plans is that you develop these objectives, you've figured out what you want to do, and then all of a sudden someone adds, well, what about this too? Or can we add this? Or can we think about this? Or we should do this as well. And sure, gathering ideas is incredibly important, but what you want to prevent doing is scope creep, where all of a sudden you're trying to solve all the problems in a society and not what you're setting out to achieve. This happens sometimes. I'm on calls where we're talking about our clinical services in Kansa, and there's a lot of concern around vaccines and making sure there's enough vaccines available in the hospital setting. And absolutely, we can call for that, we can advocate for that. But we know that, generally the vaccine programs are a much bigger project than the capacity we have to create change. And so we have to rely on other partners and more coalitions to ensure that those services are available. Now, I could try to create a vaccine delivery program, but I don't have the capacity for that. I don't have the expertise. My organization doesn't have the ability to do so. So we have to push back when people ask for too much or else we're not going to be able to accomplish anything. And this goes to any organization. But then also, for those who've seen my programs before, I also like to always add smart E, IE to everything. That when you're thinking about your objectives and goals, you really want to make sure they're inclusive, that you're really engaged, priority populations, the most marginalized as well, because they oftentimes can be neglected. So again, inclusive and equitable too, that you're really setting out to achieve support for the whole community in the best way possible. And you're really, again, prioritizing the most marginalized. So the SMART goals, you'll definitely have heard those before, but we always like to now start adding IE to them. Inclusive, that you're engaging a lot of people, and equitable, that you're reaching the most impacted. And so why do we want to see this? Again, just kind of reiterating these key points here. As more of just a reiteration and just to call back again, work plans must align with the mission vision of the organization. So again, your SMART goals and objectives should really make sure that once they're specific, measurable, attainable, relevant, time-bound, that they align with the mission and vision of the organization. They make sure they focus limited resources. Again, we don't have unlimited resources. We don't have all the money to fix all the problems. So we have to make sure we're prioritizing and recognizing here's what we can do as an organization and what should be done then. From there, these work plans, if they are well crafted, will attract funders and partners. And they will start to see, okay, we understand what you're trying to achieve, and we'll go from there and be built on the credibility of the organization. And again, that's where I keep going back to the snowball method of how organizations should try to do work plans and activities, is you shouldn't try to solve everything at once, even though everyone's going to ask you to. The idea is to start building off of, again, smaller activities, smaller projects that can grow from there. And then it could really become a bigger and bigger entity over the years. Trying to do everything too quickly or too fast just never really works out for organizations. And so now I'm going to get into some of the tools that I like to use to developing impactful plans when I'm thinking about a new activity and I want to make sure that I'm developing it in the right way. first and foremost, what I always think about when I'm developing any activity are knowing my organization's capacities. And so there's these two tools here. We're going to start with SWOT, which many of you might heard of, and then we're going to switch to SOAR, which is a newer kind of model and is more of a strengths focused one. You might not have heard of that one as much. So SWOT, again, the idea here is you look at your organization and look at its strengths, its weaknesses, its opportunities, and its threats. Strengths include things that your company does well, qualities that separate you and your organization from others that do this work. What are the resources you have, like yourself, your skilled staff, your skilled volunteers, people living with disease or what have you. Look at what resources you have there. Another, kind of systems and tools you have, like computers or property, et cetera, et cetera. Those again are trying to really say, and here's what we bring to the table. Here's what my organization can do that's different, that's unique, that can really help people. And it's important to lean into that. We want to thrive. We want every organization to thrive, but we all have to have we all have our own strengths and abilities. But next, what you want to do is look at your weaknesses. And again, this is not to say because your organization's bad or not good. Every organization has weaknesses because no one's perfect and nothing can be perfect. And so you want to look at things that your company lacks, things that others maybe do better, and look to them and say, oh, my organization has always really focused on building community spaces, community support groups. We've never done advocacy before. And I know this other organization does advocacy really well. Maybe we should partner with them a bit more to see ways we can learn about advocacy. Again, what resource limitations you have. Again, not being able to maybe provide medical services because you don't have any doctors. Unclear, unique selling proposition. Again, not being clear with your SMART goals and objectives. Next up, you have your opportunities. Again, where are ways that your organization could thrive in the environment you live in? And these, strengths, weaknesses are meant to be internal. So those are what your organization possesses or does not have. Opportunities and threats look at your external environment. So opportunities include what are ways that we could leverage the press or the media or the lack of competition or the needs and how they match with the strengths of our organization. And then your threats include what are things that could harm your organization? Emerging competition, other organizations that exist that have different skill sets, changing environment with policy or the government, negative engagement, things like that. Again, these are all super important just to think about as you're developing any work plan, because you have your problem like, oh, we need to raise awareness of this disease. All right, how does my organization have strengths associated with that? Where are we not that strong in? And what does the environment look like? And that's one way of doing it. Another way of looking at it is through the SOAR analysis, which usually, again, I would say this has a more positive lean to it. It really tries to build on the strengths your organization possesses. And SOAR is really detailed into these kind of four key buckets. So the S is really focused on what do we excel at? What are the great accomplishments? What are you most proud of? What makes you unique? I love these questions here because I think they're a great way to facilitate any meeting and start off. What do we excel at? What are our greatest accomplishments? And then O looks at your desires. What partnerships would lead to greater success? What changes align with our strengths? What are we seeing that's happening in the community that we can do something about? That's really important to ask yourselves. Next up is knowledge. What should the future look like? How can we make a difference? What do we want to achieve? And ability. What measures will tell you that you track to achieve success? How do you translate your vision of success into outcomes and so forth? I just love these questions here. I think they're such a great way of framing any work plan. And I would say if you could answer these questions as you're thinking about them, your work plan will come so easily because as you write it and develop it, because all of these will just guide you and to be able to really showcase to any donor, any funder, any program entity why you should do the work that you want to do. So again, I definitely love this analysis here. Next up, the importance around stakeholder engagement. Again, as you've been thinking probably internally with your SWOT and SOAR analyses, your really next idea is to make sure to be engaging people. And again, your stakeholders, as I mentioned, are not just those who are receiving services in your project, but includes your staff, your board, government officials, key opinion leaders, community members, you name it, it involves that. And the tool that I like to use, particularly when you're thinking about a work plan, is this thing called the Stakeholder Engagement Matrix Assessment. Sounds super official, very official, but really what it asks you to do, as you can see from this table, on the left hand column here, you're going to take a look and say, list all of your stakeholders. Let me actually pull up one moment. So you have your first column here, you have your stakeholders, and you're going to try to list out all the stakeholders you can. Now, these could be groups of people, these could be individuals, whatever makes sense for you and the project you have here, you list out. And then from there, on the top, we see unaware, resistant, neutral, supportive, or leading. And these are the buckets you're going to put these organizations in with a C for current. Are your stakeholders not even aware of your organization or the work you're trying to achieve? Are they resistant to it? Are they maybe organizations that could see themselves doing it better? Do they not see the value in what you're trying to achieve? That's always the case. Many people might not see the value in the work you're trying to achieve. That's not technically bad. It just means you got work to do. There's neutral, take it or leave it. We're not really sure if this is going to work or not, but we're not going to be involved. Um, but, generally we're not trying to negatively impact the work. And then there's supportive, which is now, hey, we think this is great. We really want to see this happen. Am I going to be involved as a volunteer? No, but in general, we could find ways to support you. Maybe I'll come to your events and so forth. And then there's leading. Again, those who now are saying, I want to actively be involved. I want to volunteer. I want to help out. I want to speak at your event. Definitely people who are going to be involved. And so what you do is you start with C's and say, okay, here's where they currently are on this matrix here. Now we see stakeholder one is currently C, unaware. They have no idea what this project is. And if that's the case, then you now know, okay, I know this individual, or I know this group of people. Here's how we talk to them. Here's how we can engage with them. And our goal is to get them to supportive. So if that's the case, going from unaware to supportive, you're going to develop a plan to say, here's how this project is going to benefit you. Here's how it's going to be really supportive of the community based on the desires you have as a group. Here's how it's going to meet those needs, and try to explain that in many different ways, moving them from unaware to supportive. Now, say you have a stakeholder like C, resistant. Um, Again, this is someone who's saying this is not going to work. We don't think this is a good idea. Maybe it's what you do is you set up a few meetings, some smaller steps to get them to say, okay, I'm not going to actively root against you or not support, but generally I'm just going to go on with my life instead. And again, this might be, for example, it could be a decision maker, a policy maker who's saying, we have limited resources, we don't have the funding for this, we can't make this happen. And you come and say, don't worry about it. We found resources to make this happen, and we're going to move forward. All right, well, you've solved that problem for them. Where's the money coming from? And now they're going to be neutral and say, okay, we wish you the fine, go ahead. But we're going to continue working on other projects with the limited resources we have. Great, that's a win right there. You no longer have someone resistant. Trust me, media is always going to find resistant people to interview and talk about your project. And then say stakeholder three is resistant, again, negative, and you want them to move all the way to leading. Well, that's going to take a lot of engagement, a lot of work, maybe bringing them into the team, finding ways to employ them or support them. It's going to take a lot of different approaches than, say, from resistant to neutral to get from resistant to leading. And again, I think this really helps any work plan and just seeing how you move all the people you need into a way that you want. And again, not everyone's going to be at the same level. You don't want everyone to be leading because then you're going to have, 18 people doing the project and not enough people supporting. But generally, you want to move people from resistant and up. But again, this is a great matrix and tool to use for people. And then finally, when you do have that group of people who are supporting and leading, setting clear roles and responsibilities, particularly with your team, particularly with your board. We know many people sometimes have a very active board that wants to be very hands-on, very engaged. But again, don't see the day-to-day. They don't see where the funding comes from. They don't see where the issues are or the staff capacity or the need for staff to have time off. And so it's important to always set clear roles and responsibilities, where the idea is we call this the RACI chart, where again, same principle applies here. You list people out on the left column here, and on the right, you tell if that individual is responsible for an activity. So again, that individual is directly involved in doing the work. They're expected to be really hands-on. There's accountable. This is the person who's responsible for making sure the work is completed. So again, this might be more of a supervisor or director, not so much doing the work of the project, but overall making sure it's successful. There's those who are consulted. The people who are saying should be consulted and get inputs on. So again, they're not doing the work themselves, but they're consulted and asked, how should this be done? And those who are informed, individuals need to know about the progress of the project and what is happening. So again, maybe your board shouldn't be in the R or the A button. Really, they should be maybe more in the C button. C column, if you will. Stakeholders should be consulted and sought inputs and feedback before commencing a project. But generally, the staff, the executive director, or the president will be the one accountable. And then there's people who are responsible. So again, another way I think always to help work plans is just seeing who's doing what and where. And then finally, the two tools here on communication that I think are really important with developing a work plan. And again, we'll get to this all, put it together nicely, is again, why are we doing this work? And that's where the work plans really become an art as well. You can describe the processes to completely of what you're going to achieve. But someone's going to have to read this project and say, yes, this is important. Yes, this should be done, and so forth. And here's funding for it. And so that's why you want to link into people's intrinsic desires and extrinsic desires. And the intrinsic are because of the interest and enjoyment in the task itself. So when someone's reading the work plan, do they see that there is passion in this, or it's fun or engaging, it's purposeful, and so forth? And then there's extrinsic values as well. Do they see where the benefit is to the general community as well? So you want to be thinking about multiple different things when coming to a work plan, including how does it really measure and reach different individuals and what they see as important. And then finally, effective communication tips. We'll skip this one. I think we're running a little short on time here. And so then finally, just as a wrap up for this, and again, these tools that I share with you all will definitely share with you after this, so definitely, and I'm happy to always email anyone with additional tools to help. Setting strategic priorities, again, the idea here is you prioritize 2 to 3 high impact areas. And again, your SMART goals, your SMART E goals will help you define what are the things you really want to achieve, how to make sure it aligns with the mission, and the capacity of the organization. The capacity comes from engaging stakeholders, including staff, team members, volunteers, and the board. And then really from there, deciding how you want to move and engage those stakeholders in different ways. And so then after you've done your objectives and your stakeholder engagement, for work plans, you want to then make sure to map your resources and engage partnerships. And we'll talk more about that. And the important thing with all of this is making sure is your current inventory of assets. And your assets of an organization, that's again, your SWOT, if you're looking at your strengths, it's your staff, the resources and money that you have, the volunteers that you have engaged, relationships, and as well as any products or materials that you've developed as well. And all of these are incredibly important here. Your volunteers, again, those who support your organization, the staff, those who do the work, funding and resources, And so, and go from there. And great, see some networking happening. Relationships building, again, the partners show and materials you developed. And again, these inventory of assets, it's just always important to think about as you're developing a new work plan, because again, likely the work plan you're developing is not the only thing your organization is doing. So you have to recognize, where do we currently already have staff working? Where do we have volunteers engaged? Where is our resources at? What other events are we having, what are happening throughout the year? All of these need to be thought of before going into a work plan. And then you look at your partnerships as well. Again, this is super critical. And I think a lot of people don't recognize that a lot of donors now, especially I've seen a lot from pharmaceutical companies and foundations, as they've been looking to support organizations, they're not so much interested anymore of just supporting single organizations anymore. They're really not. There are funds available, but they want to make sure that in your grant application, in your work plan, you're talking about how you're engaging with different people and organizations that have capacities that you may not have. And what do I mean by that? Is that they're looking to see your partnerships with researchers. Say you want to do a research project, but no one's done research on your team before. Maybe you can do some basic evaluation, but saying, oh, we're partnering with the University of Nairobi or so forth on with a researcher to evaluate the project will go a long way. Same thing with many organizations want to do more clinical work or want to open up clinics and so forth. Well, again, the idea is, okay, what hospital are you partnering with? I know Children's Sickle Cell Foundation of Kenya, going back to that, has done a lot of work with regional referral hospitals and working with clinicians to educate them and showing that they're partnering with these hospital settings to link people into care. Again, very important. Hospital settings as well. Governments, how is your local government involved or national government involved? How are you thinking about sustainability? As always, many grantors want that sort of information. And again, you could partner with other organizations as well. No one's expecting any organization on this call or anywhere really to be able to meet the needs of everyone in every space. It's okay, and I think very supportive, to be working with other organizations as well. And two, they like to know what other funders you have, and it's good to have that. It's called a CAPE statement, if you will, your capacity statement. So what projects have been funded previously or currently that can link to this work? And then the key tools that I say and things that you should be thinking about developing as you're working on your key tools for partnerships is definitely the pitch. So again, that is, what is your organization? What is its mission? What does it hope to achieve? And what is it specifically asking to be done with this partnership? So for example, with the World Coalition on Sickle Cell Disease that I mentioned earlier, the World Coalition of Sickle Cell is a public-private partnership of organizations working to address sickle cell disease in low-income countries. That's our mission. We're looking to work with national governments to prioritize sickle cell disease through strategic plans and resources. That's our kind of vision. And right now, we're looking to work with the United Nations and its high-level meeting on non-communicable diseases to incorporate sickle cell disease into its declaration to further prioritize the disease among broad stakeholders. Great. So I've given out pretty much what we're trying to achieve. Then it's up to that individual maybe to ask questions. And then from there, the idea is to pitch them as well. And we'd love for you to, A, sign on to this form, B, participate in our upcoming events to advocate for this, C, we need X dollars to make this happen, so please give us money, or so forth. So really, you want to narrow down that pitch, and always happy to work with any organization to really figure out what their pitch might be. These are very, very individual processes. And usually what they suggest, and the tool I'd say is, if you're in a elevator or you're in a situation where you only have 1 minute with an individual, in 1 minute, what could you share that would entice them or get them interested in learning more about your organization. Related documents, again, you do want to make sure that people, as much as they want to hear from you, it's very important to have some written materials, a website, or other sort of information that can be shared to talk more about how your organization has the capacity to do what it's setting out to do. Some concrete plans, again, with the work plans developed based on your SMART goals and objectives. And I'm going to share more about the final kind of what a work plan could look like, the impact and measures of success. Again, how is this going to benefit communities and how this is impactful to the partner organization. So again, some research will be needed to be done there because you're going to want to look at what their mission and vision are, what their goals are, what they're hoping to see happen. And from there, be able to say, oh, how this will benefit you. So say, again, back to the World Coalition example, we're trying to work to get a UN high-level statement on sickle cell disease. And I'm talking to, let's say, a pharmaceutical company. Pharmaceutical company that's looking to make some drugs related to sickle cell disease. I'm saying, as you're creating these, your mission as a company who makes drugs to support people living with sickle cell disease is you want to see people thrive and you want to make sure your products help people live longer, healthier, happier lives. Well, we also know that resources are needed to get these drugs to people in need. And having these high-level meetings and declarations prioritize the disease and gets more governments engaged to support this effort. And so there, it's seen as a benefit and a win-win to all the different organizations. So again, I think looking at these key things, seeing what you have done there or what you can have done is going to be really, really effective. I think I only have a few more slides here, and then we'll be able to get to some questions or just discussion. Next up is to align your efforts. Again, as you're thinking about your work plans, and this is, again, broader, probably part of the analyses, you definitely want to make sure you're aligning with national policies, strategic plans, priorities. Again, even if your government may not have as much focus on this area, it's really helpful to make sure you're aligning with what stakeholders are asking for or say are important. Make sure you're thinking about awareness days, again, World Health Day, World Sickle Cell Day, Inherited Blood Disease Order Day, Human Rights Day. All of these kind of all really help just further your message. And as we get closer to those, organizations want to know, oh, what are we doing for this? Oh, we're supporting XYZ. And so then finally, we're going to get to then the crux of now work plan development. Again, so, you've developed all of these tools and resources. You've looked at what your organization wants to achieve, what its capacity is, what the problem is you want to solve, what partners you want to engage with, all of that. So you've developed all of these kind of things. Now it's time to put pen to paper, start writing, start working on your documents, and start actually developing the work plan. And the best tool, I use this every time I'm developing a new work plan, is the logical framework. It's one of my favorite evaluation tools. Just generally, it really helps prioritizing any sort of activity you need to do. And it's here, and it's this basic table. You're looking at these columns, this row here of inputs, activities, output, outcome, and impact. And again, I'm happy to share this in a Word document, whatever makes sense to you all, Excel too, what have you. And again, you have your input, activities, output, outcome, and impact. And what happens here is your input is what do you bring to the project? And again, you spent a lot of time now on that. Here's our tools, our resources, the people we have, and so forth to make this a reality. And here's where we also are going to put the funding needs we have too. We need X number of dollars to make this happen. Then you go into your activities, particularly what will you do? And again, here's where you write out what is that you're going to do. We're going to have a radio show. We're going to have an awareness event. We're going to advocate with X number of policymakers for a policy change. Exactly what you want to do will be right here. And sometimes it takes a little thinking because people think generally like, oh, we want to get more care. Okay, but no, what is it that you're going to do to improve care here? Next up are your outputs. And again, this is where you start going into the evaluation and measuring of success. So outputs are your initial measures. So again, number of awareness events will be here. We had 4 awareness events with the community. We want to do a blood drive and get people to donate blood. Outputs, we had 30 people donate blood at an event. Again, that's where you really then easily can showcase the quick wins, if you will, of what you've set to achieve. Your outcomes are what you hope to achieve. So again, raising awareness, so having an awareness day event on your disease. The outcome will be improved knowledge among the community of this disease. And again, you can measure that through pre-post tests, etc., evaluations. We can talk a lot more about that and how to actually evaluate your impact plans. But when you're developing it, you want to say, okay, we see that people will have increased awareness. And then your impact is how will this change your region? Through the increase in awareness, impact will be more people will get tested and have access to care. So it's really a step-by-step process. And again, you just bullet point it out, draft it, brainstorm each of these buckets here. But then once you've filled out these buckets, it's so quick and easy then to turn that into a work plan in a basic Word document. You trust me on this. It'll come really quickly once you've bolted it out everything to turn this into a work plan that you want to achieve. And here's just an example here again. And oops, an apology, I forgot to add the bottom here, but I'll talk more about that. So again, your input. So say again, the idea here is we're talking about you're having radio addresses and community art events to raise awareness about the disease. And we're going to engage, we have a staff, we have a hospital that's going to work with us, healthcare professionals, persons living with the disease, and community members are all already engaged and ready to help to support the number radio addresses and 3 community events. So our activities are based on the budget and our plans and our capacity. In the next year, we're going to have 5 radio addresses and 3 community art events. Our outputs then can be the number of radio addresses done. Again, we did 5. Great. That's our goal. Number of community art events held, 3. Number of people attending the events. Again, that's where we can start to showcase, all right, 20, 30, 40, 50 people come. We see increased knowledge of the disease, reduced misinformation about the disease, and improved testing and retention and care. And then finally, what you can also always add to these tables are 2 areas called assumptions and risks. Your assumptions are kind of those things that you just think are going to happen because you've built those relationships already. You don't have it confirmed, but you believe they'll happen. Like, the radio addresses will host information, like the radios want to do this. You've seen them happen, but you can definitely get those radio addresses to happen. And your risks are things that are outside of your control, but things you might want to mitigate, like ensuring accurate information is presented. And so then finally, again, once you've filled out that log frame and developed that tool, all it takes now is just putting, as I said, pen to paper, or let's be honest, we're in digital age, working on your computer too, is your work plan. Again, you can start off with the basics of what your organization is, who you're reaching out to, what kind of money you're requesting. And again, you start with the background. This is where your analysis will be. Here's what the problem is. Here's the challenges our community faces. Here's the lack of education on this disease. And you're going to introduce your organization. Here's what our organization has done. Here's our mission, our vision. Here's what we have accomplished as an organization to make things happen. And here's what we want to do. Our project objectives, SMART objectives 2 or 3. Your narrative then goes into detail based on that log frame. Okay, here's the activities, here's what we're going to do, and so forth. Here's how we're going to measure success by the number of people attending the event, by changes in knowledge around the disease, and then your conclusion, wrapping it all up in a nice, we really appreciate this opportunity to work with people, and here's our work plan, here's what we want to achieve. I think I'm wrapping up now. So again, my concluding remarks for all of this is to trust your capacity and trust your staff. Again, it's always a matter of knowing where your skill sets are, where you hope to achieve. Make sure the building blocks are there, and to always, again, work with partners. So I hope that was a helpful kind of review of some of the tools and resources that I've used. As always, if you have questions or if there's anything that I can do to help you in the development of your strategic plans, your work plans, or your effective goals, feel free to email me. My email is here. But I'm happy to stop now and see if there are any questions from the group. And right now, as always, I mentioned, the Q&A and the chat feature are open. This also is pretty informal. I don't know if you might be able to raise your hand or ask. Actually, I don't think you'll be able to unmute yourself, so feel free to use the chat feature. Oh, thank you, Victoria. Much appreciated.
Thank you so much, Andrew. And yes, please feel free to drop your questions in the chat or raise your hand or even use the Q&A. We still have some time to take questions and it's an open discussion, so please feel free. And Andrew, we say thank you, thank you, thank you. We are getting so many messages just thanking you for the insightful and informative presentation.
Of course, no, always happy to. And again, I always will tell everyone, you see my email here. Any organization that wants to talk one-on-one, engage in a conversation, always happy to do so, to see ways that we can align what the tools that I've shared with what you're setting out to do.
We still have some time for questions, so please feel free to drop your questions. And yes, we will provide the slides.
Understand if there aren't any questions, we can definitely finish out the day. I know it's late in the day for many people too, so not offended if there aren't any questions, but happy to also always help, as I said, offline or via email.
Yeah, I'll just go ahead and share my screen and
I'll stop sharing mine. Yeah.
a few more details. Okay, I don't think we have any questions so far. So I just want to say thank you all so much for joining us today. And we hope that this session was very insightful and you're living here with practical tools to support your strategic planning efforts. And the GANSID will like to say a huge thank you, thank you, thank you to Andrew for sharing such valuable insights and also just helping us understand better how to develop effective strategic work plans. We really appreciate your support, your presence. You're always ready to just jump in and offer your expertise. So we appreciate you, Andrew. And also, as a reminder, I just wanted to let everyone know that we also have an online training module. So we have 8 more modules, including what Andrew just shared today. So if you come to our website, just go to patient organizations and then click on training, mentorship and capacity building, and then online training. You'll see this web page, then come here and click access the course module, and then just register, enter your email, address, your first name, last name, and you'll be able to access all the modules. Let me see. And before we close today's session, I just wanted to highlight some of the activities that GANSID will be having this year. One, I wanted to just highlight that GANSID became a civil society organization of World Health Organization, WHO, and we are also now a member of the Non-Communicable Disease Alliance, NCD Alliance. And we want to also say thank you to some of our partners and collaborators. And some of the events that GANSID will be taking part in this year, we have the World Health Assembly coming up in Geneva in May. And also in June, we do have the Sickle Cell Global Congress on Sickle Cell Disease in Abuja. So GANSID will hold a meeting on the 2nd of June. We'll meet with some government officials, clinicians, patient organization. So if you'll be in Abuja, please join us on the 2nd for the meeting. And I will drop Mr. Ayola's email address for you to get in touch with him, because we'll be sharing more details on where we'll be meeting, what time. So I'll just go ahead and drop his email address in the chat real quick. Feel free to email Mr. Ayola. I dropped his email address in the chat. And also, we'll be having our virtual Congress in November, so November 14th to the 15th. Stay in touch for that. And also we'll be at ASH, American Hematology Society Conference in December. Lastly, please feel free to connect with GANSID. You can follow us on Instagram and Twitter, which is now X, at iBlood Disorders. And on Facebook and LinkedIn, you can search Global Action Network for Sickle Cell Disease and Other Inherited Blood Disorders. You can email us at info@inheritedblood disorders. inheritedblood.world, and our website is inheritedblood-disorders.world. And lastly, I wanted to thank you all, and please stay tuned for our next session. We'll have another webinar in July, and we'll be discussing leadership styles that work, and we'll send poster details very soon. So please stay tuned, and thank you so much for being part of today's session and all the work that you are doing in your organizations and hospitals to strengthen the inherited blood disorder community. And we look forward to connecting with you all again soon. Thank you, thank you, thank you.
Thank you all. Have a great day.
Thank you. Take care.